Hello, everyone. My name is Anu Murthy. I'm a staff physician at Emory Student Health, and I'd like to share a COVID-19 quick case with you. So this case identifiers have been modified. It is presented for educational practice review purposes only. The patient, 20-year-old white female, called Student Health virtual COVID-19 assessment team with a 10-day history of fever, chills, shortness of breath, chest pain, cough, sore throat, myalgia, headache, and a rash. She had known exposure to a COVID-19 positive patient, her roommate. Her past medical history included asthma, anxiety, allergic rhinitis, and intermittent hives. She was seen the next day at Student Health Acute Respiratory Clinic. Her exam findings, vitals were stable. Exam was normal except for a rash. She was presumed positive COVID-19 and was placed on isolation protocol. She was followed closely via virtual monitoring, mainly due to her asthma, her clinical course. By week 4 after onset, all symptoms resolved except for the rash, which she described as moderately itchy. She was referred to dermatology for evaluation, has had one telehealth dermatology appointment, and is on high-dose antihistamines, fexofenadine in the morning and cetirizine in the evening. Her rash on the right wrist, urticarial, on the left forearm, also urticarial, and her left leg, also urticarial in appearance. And that is all I have. Thank you very much for your attention and time today.
My name is Justin Cheeley. I'm a dermatologist here at Emory, also a dermatology hospitalist and internist. And it's my pleasure to share with you some cutaneous manifestations of COVID-19. So initial reports from China did not really disclose much in the way of cutaneous manifestations, and that's what we thought for the longest time. However, as the COVID-19 pandemic took over Europe, we began to hear reports of skin manifestations in some of those individuals. And as it involved Americans, we've gotten further clarification on some of the skin manifestations of this disease. The largest study to date was from Spain, where over a prospective period of time, about 2 weeks or so in April of 2020, certain Spanish dermatologists who were redeployed to the front lines to care for ill were tasked with looking at and characterizing the cutaneous manifestations of their patients, as well as some of the other demographic information and correlates with the PCR and antibody testing. So what they described were 5 different categories. The first is probably the most well-known, at least the one that's been distributed among social media circles and throughout the news, and that's this COVID-tose or pseudo-chilblain appearance, which appears just like Perneo. That was seen in about 20% of individuals throughout this 429 patient case series. Another manifestation were nonspecific vesicular eruptions, chickenpox-like eruptions, which were described. However, unlike chickenpox, these were more monomorphous instead of polymorphous vesicles. Another manifestation, which is typical and common of many viral infections, not just SARS-CoV-2, are urticarial or hive-like lesions, which were seen in about 20% of individuals. Maculopapular eruptions were by and large the most common skin manifestation, encompassing up to about half of the patients encountered. These are measles-like eruptions where you have some raised papules and some flat macules. They're pink, usually on the torso. And then usually in patients who are more acutely ill, livedoid necrosis and discoloration has also been documented and seen in their cohort as well as throughout the world, especially in the United States. So in terms of where these cutaneous manifestations occur in the disease course, it seems that the initial manifestation, even before patients are symptomatic, when they are shedding virus seems to be the vesicular eruption. So per some of these reports, that chickenpox-like eruption seems to be the first cutaneous evidence of COVID-19. Subsequently, sort of commensurate with symptom onset, urticarial or hive-like lesions and maculopapular eruptions are seen. Usually a couple days into the course, when symptoms tend to escalate and worsen, lividoid pattern and acral purpura and necrosis are seen. And then typically, maybe as an evidence of convalescence, the pseudochilblain or Perneo appearance is seen. And these are conditions that or cutaneous manifestations that are least likely to have nasopharyngeal swab PCR positivity and more likely to have antibody positivity. So going through some of the manifestations themselves, this is an image of the pseudochilblain or Perneo like manifestation. It usually occurs on the feet and the toes. It might start out with macular erythema that then progresses on to edema and purpura. Sometimes you can get vesicle formation and pustule formation, as well as some erosions. This tends to occur in younger individuals who are otherwise healthy, who have cleared the virus. They tend to have a paucity of any symptoms. And this seems to be coincidental with potentially a convalescence, a clearance of the viral infection. Now, a third of these lesions are asymptomatic, another third are painful, and then another third are pruritic. And so for the pain, pruritus, sometimes topical steroids are utilized. Full dose aspirin is also utilized, pentoxifylline, other medications that are typically used to enhance small vessel perfusion. So in addition to the toes, one may also see these on the heels, kind of as a more edematous kind of pink plaques. Sometimes these can form into more purpuric or dusky looking plaques. And then rarely these can also show up on the fingers and the dorsum of the hands, which in Perneo is a little bit atypical. Usually with Perneo, you'd see them more commonly on the distal fingers, but with COVID-19 induced Perneosis, it's not quite as commonly seen on the dorsum of the digits. And of note, these cutaneous manifestations, at least in this 429 patient cohort, only one patient had reported a prior history of Perneo. So this is a novel manifestation, not a recrudescence of an existing dermatologic condition. And again, these cutaneous manifestations of Perneosis are the ones that are least likely to have nasopharyngeal PCR positivity. The other eruption, which tends to occur even when patients are pre-symptomatic, are vesicular eruptions. So these are chickenpox-like fluid-filled vesicles that are typically on the torso. They seem to last for about 10 days or so. They tend to be monomorphous as opposed to chickenpox, which tends to be more polymorphous. And sometimes they're itchy, sometimes they're painful, and other times they can be also asymptomatic as well. In addition to the torso, these pseudovesicular or vesicular eruptions can also occur on the dorsum of the hands. You can see here these kind of umbilicated papulovesicles that look kind of like chickenpox or even molluscum, and then some of these with the central hemorrhagic crusting at the apex where the vesicle begins to rupture. And again, these pseudovesicular eruptions are seen in the pre-symptomatic phase and earlier in the course of COVID-19. Here is a representative of an urticarial eruption associated with COVID-19. Now, urticaria, acute urticaria, is most commonly caused by infection. 40% of cases of acute urticaria are caused by infection. So urticaria is not in any way specific to COVID-19. In fact, a lot of infections and viral infections can precipitate hives, giving off this kind of characteristic polycyclic kind of arcuate morphology with some central clearing, these kind of evanescent sort of coming and going plaques that tend to be kind of itchy or painful. But urticaria is also seen sort of coincidental with symptom onset in patients with COVID-19. Some evidence of urticaria you can see is dermatographia or dermatographism. So these linear kind of plaques where patients have been scratching, they tend to urticate in those plaques. And then you can see here over on the lateral back, those kind of polycyclic and arcuate plaques. Papulosquamous and digitate dermatoses have also been described in one case report in JAMA Dermatology, where instead of urticaria, this tends to be a little more scaly, and digitate, meaning it tends to be finger-like. And these are kind of oriented along skin tension lines on this patient's torso, arms, and abdomen. And then as far as the most common manifestation of COVID-19 in the skin, it's going to be a morbilliform eruption with these like pink to red macules and papules, which are also common for nonspecific viral exanthems. These macules and papules that tend to be on the torso. Sometimes they can be a little bit more atypical for maculopapular viral exanthem. These can also occur on the dorsum of the hands and the fingers, kind of be a little bit more edematous and can look erythema multiforme like. And then a couple of patients from Italy, just kind of showing some of the manifestations here. You can see the characteristic Perneo that are on the feet and toes of this young individual here. These kind of violaceous patches and plaques that starting to form a little bit kind of duskiness centrally. And then on the dorsum of the hands and fingers, as well as on the elbows, you can see these kind of edematous papules, flat top papules. Some of them look a little bit targetoid. And so these are what are described as erythema multiforme like. Another characteristic skin finding that we've seen is either unilateral, as in this patient's case, or sometimes bilateral, transient livido reticularis. So livido reticularis is a net-like violaceous discoloration, usually of the thighs and proximal arms. In most individuals, livido reticularis is physiologic, and it's from constriction of the superficial cutaneous arterioles. And so you have this predominance and stagnation of venous blood within the superficial venous plexus of the legs, which tends to give it this kind of lacy or net-like appearance. So anything that perturbs the normal venous return and arteriolar perfusion can result in livido reticularis. And so it's hypothesized that in these individuals, because of the transient and sometimes more aggressive hypercoagulable state that these patients experience, that they could have some micro vasculature thrombosis or at least sluggishness in the cutaneous microvasculature, leading to this livido reticularis phenotype. You can also see kind of more purpuric changes, especially in areas of dependency. So these kind of purpuric net-like patches that you can see on the buttocks of this older gentleman affected with COVID-19, and then these kind of more sort of hemorrhagic confluent ecchymotic patches that you can see here on the buttocks, proximal thighs, posterior thighs. And these features we see with some types of viral infections, notably parvovirus B19. On the more severe end of the spectrum, you can see acral ischemia and tissue necrosis. Usually these patients have low-grade or fulminant disseminated intravascular coagulation. So their most acral surfaces tend to be thrombosed from microemboli affecting the distal most cutaneous vasculature. So you can see here eschar of the distalmost tips of the fingers, as well as this kind of dusky erythema, which is present on both the volar as well as dorsal aspects of the hands, fingers, feet, as well as on other apical surfaces, such as the tip of the nose. So, a couple different skin manifestations have been described with COVID-19. Pseudochilblain, vesicular, urticarial, maculopapular, and lividoid eruptions. I did not go into the pediatric manifestation, the multisystem inflammatory syndrome, the Kawasaki's-like condition that's more typically seen in children. There are some reports out there of it occurring in adults as well, but that is yet another unique manifestation that we're seeing with this very unusual virus. And so, depending upon the patient's comorbidities, how old they are, and sort of their overall immunogenicity and immunologic response to the virus will dictate how they present. So it's thought that the pseudochilblain represents effective intrinsic interferon production by the patient that then sort of precipitates this vasculopathy and sort of low-grade vasculitis in acral distributions. But this seems to be a good marker, a marker of clearance and of a healthy individual, whereas the lividoid or necrotic appearance could either be too aggressive of interferon production by the host or insufficient viral suppression causing disseminated intravascular coagulation and necrosis. And then these other cutaneous manifestations seem to be sort of in between. So patients who are suffering from and symptomatic from the disease, but most of these individuals tend to do fairly well. And that is the end. Thank you so much for having me.